All right, welcome. Thank you for joining us today. My name is Melissa Crispell. I am your host, and as you can see, I am not solo today. I have a guest with me. I have Dr. Joel Kahn with me. For those of you that don't know who he is, you have to be living under a rock because even I saw him on my Facebook ad with the specific meal box, and we'll let him talk about that in just a moment. Dr. Kahn is a holistic cardiologist. You wouldn't think that those two words go together, but he does it very, very well. He is an author, and he is America's Healthy Heart Doc. He's here with us today. So thank you, Dr. Kahn. Thank you for being with us.
Well, my pleasure, and everybody get Heart Smart in February and all the other months too.
That's right. Not just for February, but we'll call your attention to it in February.
Right.
All right. We're going to do the speed round. I have these lightning questions here, and you're poised to give our viewers all of the answers so that they can get heart healthy.
If I know the answer, I have a bell. I'll hit it, and then you'll tell me when I can answer.
Raise your hand. And don't you have to form the answer in the form of a question? Is that how this game works?
That's right. For $400, please.
There we go. All right. So first question is a two-parter because we have to look at, the good and the bad, right? That's how we do it. From a nutrition perspective, what foods should we eat to be heart healthy? And what foods should we consider just absolutely getting away from as fast as we possibly can?
Okay. I feel like I'm in the spirit of Dr. Jaffe doing high-level Talmudic analysis. On the one hand, foods to stay away from. And we've known these for a long time, but this is all based on older data, recent data. In the summer of 2020, the Cochrane database, many people feel the most authentic meta-analysis and systematic reviews, announced again, excess saturated fat in the diet causes cardiovascular disease. When you replace saturated fat like butter, like lard, like marbled meats, like excess cheeses, when you replace them with whole foods, whole grains, or maybe even polyunsaturated fats like extra virgin olive oil, which is mainly monounsaturated fat, vegetable oils, your risk of cardiovascular disease goes down. So number one, cut down on your saturated fat. I'll also say in April of 2020, a study was published called the ischemia trial. Can we avoid bypass and stents in the majority of sick heart patients and use medication and lifestyle? What was their recommendation? Low saturated fat diet. Goodbye cheese, goodbye butters, goodbye marbled meats, goodbye lard, goodbye probably coconut oil. So excess sugar, sure. Stop drinking sugar-sweetened beverages. Please, pies, cookies, cakes. Watch barbecue sauce, ketchup, places where sugar can be exceedingly high. And last, I'll just say fried food, fried processed food. Data in the last 2 weeks emphasize the risk of fried food for cardiovascular events and also true of processed foods. Learn how to open a can of beans, chop up some vegetables, make a bean stew or a bean chili, real food for real people at a low expense. The traditional Mediterranean diet, of which there's now a version called the Green Med diet, the Mediterranean diet with even more super concentrated greens, and it can be very powerful in terms of cardiovascular risk factors and fatty liver reversal. Very cool diet. Everybody should read about it. It's new data out of Israel.
Nice. Thank you very much for sharing that. Mediterranean is the way to go. I saw an article that said that was
better med than dead. That's what they say. Better med than dead.
It's voted the meal plan for 21. So
that was U.S. News and World Report, and that's been basically every year. And just so people know, there's a branch off the Mediterranean diet called the DASH diet, a lower salt version, wonderful for hypertensive disease. And now there's a branch off called the MIND diet, M-I-N-D, for brain health. It's the Mediterranean diet with even less animal products, more blueberries, more brain supportive whole foods.
Interesting. So we're talking about the Mediterranean diet, Mediterranean area where folks are living a little bit different. How many studies have come out about the lifestyle there versus the lifestyle that we all lead here in America? What if we have a family history of heart issues? Are we doomed?
Sayonara.
Yeah.
Okay, no, you're not doomed. Probably the best statistics are genetic input on the development of cardiovascular disease, maybe as much as 30% of the pie. Don't eat the pie, but the vegetable pie. And lifestyle, particularly food, fitness, and smoking, are 70%. There clearly are real genetic factors. You can inherit a kind of cholesterol called lipoprotein little a that could cause you to have heart disease you don't know about. You could inherit familial hyperlipidemia and have a cholesterol that's very high, even with a very healthy diet. Get your blood checked. You could potentially inherit a gene called ApoE, and if you've got E4, your risk of cardiovascular disease on a genetic basis, and others that we could talk about. But it's pretty clear that whether you have that testing or not, you can overcome most of the risk by a healthy lifestyle. Goodbye cigarettes, hello gym shoes, goodbye processed food, fried food, added sugar, added saturated fat. A plant-forward diet, a Mediterranean-style diet will overcome most of the risk. So, Dr. Dean Ornish years ago showed if you actually measured gene activity, when you introduce his lifestyle heart program of whole plant diets, stress reduction, meditation, group support, you actually turn off genes that cause inflammation, turn on genes that are about repair, healing, and reversal. So yes, you can influence whatever genes you inherit in life to some extent by a healthy lifestyle. So forget the sayonara, come back, and be part of the living.
Be part of the living. Any particular tests that we can run to help us predict a cardiac event or predict what our cardiac status is going to be?
Yeah, I have right in my desk, I'm in my office, I have a Ouija board and I have a crystal ball. And I tell people I have the ability to predict. But I also order an actual test called a heart calcium, a real test, done at a hospital, no financial conflict. I don't own a CT scanner. But in my town, for $75, you can get a heart calcium CT scan. You lie down, you hold your breath, and you go home. They're not going to poke you with needles. They're not going to inject you with iodine dye. If you've never had a stent, a bypass, a catheterization, a heart attack, you just assume your arteries are pretty good or great. This is the only way to confirm if your arteries are good or great, and you'd rather be great. You may or may not be able to see there's an arrow pointing to a big hunk of white in the widowmaker artery of the left anterior descending artery region. That's not ideal. We can work with it. We can deal with it. We can attempt to lower the risk dramatically. But you want to do that test when you're 45 or 50, maybe even earlier if you're a smoker or diabetic or strong family history of heart disease. Definitely about age 45 or 50. And maybe never do it again. Maybe do it again in 10 years. Very low radiation like a mammogram and totally painless. Heart calcium CT scan. Sadly, you do need a prescription. I have a pre-printed, I order so many of these, I have a pre-printed prescription pad, calcium CT scoring. Some doctors aren't familiar with ordering them. This test is 30 years old. Nothing new under the sun. Endorsed by the American Heart Association, European Society of Cardiology, and similar august bodies. Just need to incorporate it like colonoscopy and mammography as just an absolute routine test.
What's an optimal calcium score? What are you looking at? A 0.
0.
Got it. Absolute 0.
I'm not saying that anybody you're talking to has a 0 at age 62, but 0 is a good place to be.
Okay. This is the one time you want a big fat 0.
Yep.
All right. What about supplements? Are there any supplements that are beneficial for our heart?
Blueberries, raspberries, boysenberries, and lots of other berries. So, but into supplements, I'm a graduate of the PERC integrative program and other training programs and supplements. And yeah, I do favor them. I usually guide them by the disease, the history, the lab values. I mean, don't walk around with a low vitamin D, particularly now during the pandemic. It's too important in your immune function. Don't walk around with a low zinc, too important right now with your immune function. In terms of heart, I love coenzyme Q10. Certainly if you're on a statin lowering medication, but even if you're over 40, not on one, for palpitations, blood pressure, migraines, and maybe for cardiovascular health. I love vitamin C. I'm a big fan. I certainly know Dr. Jaffe is. And we can do the cleanse test to see if you want to actually try and dose your vitamin C to your optimal level of need, or at least a few grams, if not more, of vitamin C a day. A lot of that's based on the famous Linus Pauling, PhD, and the theory that collagen formation requires lysine, proline, and vitamin C, and we often don't get adequate amounts in our nutrition. Very safe supplement to take. And that's where I start. There's many others to consider. A lot of magnesium, a lot of CoQ10, a lot of vitamin C, routine vitamin D and zinc.
There we go. That's a good baseline for people to get started. Thank you for that. What about reversing damage? Is that possible? Can we repair damage that we've done to our heart?
Yeah, there's still a holy grail of one kind of damage would be, Doc, I had a heart attack. They did measurements and my heart strength is diminished. Can we bring it back? And we don't know for sure. There is a protocol called the Sinatra protocol, the Sinatra metabolic cardiology protocol of using CoQ10, magnesium, ribose, and a nutrient called L-carnitine. And I had a patient last week from Texas, ejection fraction, which is a measure of heart strength, 25%, which is very low. And we measured 2 months later, it was 48%. Was it my supplements I recommended? Was it spontaneous because nothing else changed? That's dramatic. And I didn't expect that, to be honest, but it's nice to see. That's one kind of damage, and you can try and reverse it. Stem cells and other approaches, we still are unclear if we can take damaged heart muscle and bring it back to life. And then we got the issue of the very common, atherosclerosis, arteries that are partially or even severely clogged. And that gets you back. I mentioned the name already, Dr. Dean Ornish, Cleveland Clinic, Dr. Caldwell Esselstyn, the famous Mr. Nathan Pritikin. I do believe you can influence that disease and cause it to start to reverse. And that is the combination that's been researched. That's why Medicare will pay for patients to do something called Pritikin rehab or Ornish rehab, plant-forward diets, stress reduction, emphasize sleep, social support, and regular fitness. Of course, don't smoke. And if you do them with adequate tenacity and regularity, you may actually influence your disease to start to go away.
Very good. Thank you. Very doable recommendations here. I think that folks, if they really want to take control.
It's just food. Don't fight it.
Yeah, exactly. So tell me, if we might have patients out there watching. We get patients watching our channel too. If they want to work with you, is that a possibility? And how do they get a hold of you? What do they do? Where do they go?
I'm a tough rascal to get a hold of. I'm only on Twitter, Instagram, YouTube, Facebook about 100 times a day. Sometimes other channels too, like this. I'm pretty easy. I'm in suburban Detroit, but I do telehealth and do work with people actually all over the world. drjoelkahn.com, drjoelkahn.com. And that'll link you to my clinic. The clinic has a separate website, KahnLongevityCenter.com, Kahn. And I'd be happy to work with anybody. I'll give anybody my email, drkahn@kahncenter.com. Shoot me an email. I'll answer personally. drkahn@kahncenter.com.
Thank you for that. And we will drop.
Oh, wait, we were going to talk about the best foods. Can I just add a couple?
Yes, do it.
I had it. You did prep me a little bit for these hot questions. So I just throw out two acronyms. One I am lifting right from Dr. Jaffe, and that's to ensure you get enough sulfur-containing foods for cholesterol control, immune health, and overall health. And that's ginger, garlic, onion, the brassica, like broccoli, Brussels sprouts, bok choy. And then Dr. Jaffe puts in eggs, which are very sulfur-rich because of the smell. I more advocate watching, limiting, or not using eggs, which I don't eat myself. And then there's another acronym called GBOMBS, GBOMBS, like the best foods to make sure they're in your diet. These aren't the only foods you eat, but these are the super charged foods. G for greens, B for beans, O for onions, there they are again, M for mushrooms, and the final B is for berries. And if you want to do GBOMBS all the way to the S, it's for seeds, like chia seeds, flax seeds, sunflower seeds. Fun one. GBOMBS and GGOBE, ginger, garlic, onion, brassica, and eggs.
And these should be staples in our diet. These are not like the extravagant, luxurious, we'll eat these once a month.
Right.
These are things that we should be eating regularly.
Yeah, there should be a wearable that reminds you during the day, have you had enough onions today, mushrooms today?
Yeah.
If you haven't, it provides a painful shock.
Yeah. If someone doesn't like back away when they smell your breath, you haven't had enough garlic. Is that what it is?
Yes.
Yeah.
So we're wearing a mask, so it's the best time to add garlic and onion to your diet.
There we go. Thank you so much for being here. Is there anything else that you'd like to share with all of our viewers about heart health and what they can do to help themselves?
I really would emphasize that heart calcium CT scan. Nobody wants radiation, although there is a little theory of longevity that what doesn't kill you makes you stronger, and that actually includes minuscule doses of radiation. But take that one off the table. Get a heart calcium CT scan. Don't walk around blind, even if you're healthy on the outside. I'll give you an anecdote. 2 hours ago in my clinic, 56-year-old financial planner, has run 13 marathons. He's 6'1". He weighs 170. He eats plant-based, for God's sake. And really, there's no flaw you can find. His calcium score is over 1,000. So this was a new patient, and now I've got to kind of dig into and try and identify what did he inherit, what hasn't been tested. But if that case study can happen, and his lifestyle still can be associated with calcification of his heart arteries that is in the 99th percentile, it's way more than expected.
Yeah.
How do you know you don't have the same problem? Please get checked.
That's right. Get checked. I tell people that all the time when we talk about food and chemical sensitivity.
Test, not guess. That's what I use as a hashtag. Don't guess about heart disease. It might be the last guess you make.
That's true. That's an expensive risk there.
Correct.
Thank
it could
you.
be very profitable to the surviving spouse, but you don't personally want to give up your life for that reason.
Absolutely. Thank you, Dr. Kahn, for being with us. We appreciate your time.
Please give my regards to Professor Jaffe.
I will do that. Take care.